Do you think the ancients looked at that, understood the personalization maybe a little bit more?
They definitely did. It's actually one of the hallmark statements of Chinese medicine is you treat the person, not the disease.
Mm-hmm.
So when somebody comes to me and they have rheumatoid arthritis, or they have MS, or they have psoriatic arthritis, or they have Crohn's or ulcerative colitis, I don't treat any of those things. I treat the person showing up that may have the symptom of Crohn's, or the symptom of RA, or the symptom of back, or the symptom of this, because what caused your back pain and what caused my back pain is going to be different. Maybe you were playing tennis and I was playing rugby, and, or you were playing rugby and I was playing badminton, or like whatever it was. I was knitting and I hurt my back, and, the mechanism of injury, the mechanism of the onset of disease is going to be different. So of course the treatment is going to have to be different.
Do you find it difficult to tell patients that and have them understand that? Because I know at our center, it is when you get that first call, it's either do you accept insurance is the first question, or, right? Or it's do you treat X disease, my diagnosis? And you try and explain it, and you only have a certain amount of time on the phone. And it's sort of like, I feel like the eyes glaze over when you don't give a yes or no. And people are just like, well, do you or don't you?
Yeah. Yeah, I know people really do look for that certainty. And over the years, I've come to answer that I've worked with this disease pattern quite a bit, and every person is unique. But I have worked with the disease.
Yeah. It's a very diplomatic answer, right?
Well, and I think legally, I'm not allowed to say I treat diseases.
Right.
For insurance model, I have to diagnose something, but I'm not allowed to treat it. It's like a duality within our medical system that is so broken that you have to give a diagnosis, but you can't say you're treating it. And
I know, it's crazy. It really is. When you look at some of medicine and you see what you have to do and what you can't do, it's so contradictory. It's so like, who came up with this, guys? You're telling me I have to diagnose, but I can't treat that then. What's the point of all this, guys? Like, really?
In some of the acupuncture companies, they require a diagnosis, but they don't pay for a diagnosis. So you have to do the evaluation and come up with the diagnosis, but they don't justify paying for it, but they won't pay you for treatment if you don't do it.
Right. And again, this is something the ancients would probably scoff at and be like, what's the point? Again, so you even take a Socratic kind of, viewpoint of this and be like, why would we do this if this is the, and you'd come to the natural conclusion that we shouldn't do this, right?
Yeah, exactly. It's really, it's just common sense. There's not there's no justification for it other than it's a business model that doesn't have patient care at its highest priority. Basically.
Yeah, and complexity actually works in everyone's favor. You need more people. You need the industry has to be there when it's this complex. Yeah. And the more complex it is, the more reliant you are on this industry. And so the whole circle of life goes on within it.